Hello, panel pickers. Welcome to the world of social health and our burning question: can social media benefit the health experience? Think we're crazy, wondering why we asked? After all, social media, it's just a fad, for the techie, tweeting crowd, those under 30. Well, maybe. Maybe not. Social media is here to stay. Need proof? Pope Benedict XVI, born in the pre-computer year of 1927, recently joined the esteemed Twitterati. June 28th saw the first Pope tweet. President Barack Obama will be personally tweeting during his upcoming re-election campaign. Keep an eye open for those White House tweets signed BO, meaning those views are his own. President Obama recently hosted one of his famous town hall gatherings via none other than Twitter. Wonder if that was really well received by the public? TwitSprout data indicated there were 94,000 Ask Obama tweets leading up to and during the Twitter town hall. I'd say that was pretty well received. CDC Emergency, the most popular Twitter feed from the Center for Disease Control, has over 1.2 million followers. Have you ever looked for health information online? If so, you're not alone. The Pew Internet and American Life Project tells us 80% of adult internet users seek health information online. A whopping 786 hospitals here in the U.S. have Twitter accounts. 551 hospitals utilize YouTube to share health information. These are some big numbers. I guess that means we are ready for a group hug, all hail social media in the health setting. Not so fast. It's not that easy. Social media gets mixed reviews from the different health stakeholders. Some think it's the new frontier in communication and content sharing, while others are hesitant, citing privacy, legal, and even time commitment concerns. Defining social media very broadly, ranging from using email for patient appointment scheduling to mobile apps sponsored by the practice, 100 U.S. physicians were asked about the use of social media in their medical practice. In data collected by InCrowd, 36% of the physicians indicated they use no social media whatsoever. These are really some conflicting stats, differing views, and this has our panel wondering, does common ground exist for the use of social media in health? And just who are these stakeholders? Have you ever been to a doctor? Then you're a stakeholder. Doctors, nurses, medical students, they're stakeholders too. Hospitals, health systems, your insurance company. Yep, a stakeholder. Actually, anyone involved in giving or receiving health for treatment or prevention has a stake in the health system. And that would be just about all of us. So if common ground does exist, where could we find value bringing social media into the health setting? Could it help build trust or sense of community? Could it create a network of support to share the health burden? Perhaps it will simplify the health process for both consumers and providers, or enhance communication through connection and engagement, or maybe a platform for education, or maybe all of this is just wishful thinking. It truly makes you wonder, should we bring social media into the health setting? Can we find a starting point where everyone is comfortable? Our South by Southwest Social Health Panel plans to explore these questions. We're going to use communication as the foundation for bringing together voices from the different stakeholders. So how do we plan to move minds, or at least tap into them? Well, you remember all those health stakeholders? We're going to ask them some questions. We want to know, hey, which social media tools have the biggest potential to benefit? Which ones are you concerned about? Which ones seem like a good fit? Which ones seem problematic? What kind of concerns do you have in bringing social media into health? And we're going to do this via some mini surveys. After we ask, we're going to analyze, looking for common ground. Which tools were identified by both consumers and providers? Which were noted as being a better fit? Which were noted as a long shot? Where are the differences and disconnects between consumers and providers? Is there a good starting point? Should we do this? The value of our panel is not in our individual views, but in our backgrounds, our diverse access to those involved across the health experience, our ability to amplify the voices of consumers and providers, our health experience on both sides of the social media belief system, our desire to discuss, gain input, share needs, and define expectations. Diversity does make the best picked panel. Our goal is to represent all the different voices that participate in health, bringing them together to benefit the experience. Our panel, together, covers mental health, physical health, providers, caregivers, health systems, marketers, researchers, educators, nonprofits, for-profits, social services, both coasts, and the middle of the United States. Thanks for stopping by. We encourage you to positively vote for our panel submission and have a voice in your own health experience. All of the work from this panel, the data, learnings, and social health graphic will be openly shared across the health community and with anyone interested in enhancing the health experience.